In this figure,
كأي
you see height of the bones of the body. Long bone, flat bone, short bone, irregular bone, and sesame. What is sesame bone? The sesame bone is a bone in thickness of the tendon. The function of the sesame bone is repair of direction of the tendon. Tendon of quadriceps is toward the median. For regulate of this direction laterally, you have sesamoid bone. This sesamoid bone is called patella. Patella is a sesamoid bone, is thickness of the tendon for regulation of direction of the tendon. Okay. But in the limb, the most important bone is long bone. This one is patella, the sesamoid bone, is thickness of the tendon for repair of direction. In the limbs, there are many long bones. For example, clavicle, humerus, ulna, radius, metatarsal, and phalanx. Phalanx is miniature long bones. In lower limb, femur, tibia, fibula, metatarsal, and phalanx are long bones. For this reason, we must learn more in long bone. In this figure, you can see a long bone has three parts: proximal end, distal end, and body. This terminology is in live anatomy. Okay? But in embryonic period is called epiphyse, proximal epiphyse, distal epiphyse, and diaphyse. Okay? When we lie in uterus before birth, all long bones are cartilaginous. All long bones has a model of cartilage. A model of cartilage. This one is a long bone, okay? Has a model of cartilage. Proximal, distal. Proximal, epiphyse. Distal, epiphyse. This part, diaphyse. In embryonic period, in large into the uterus, appear a primary ossification center. Primary ossification center into the diaphyse. Okay? And change cartilaginous to bone. Cartilaginous to bone. Okay? All primary ossification center appear into the diaphyse, and time of appear is before birth. Before birth. For this is then when we birth, all long bone, diaphyse of long bone are ossified, are bone. Okay? But this area, epiphyse, proximal, and distal, are cartilaginous. After birth, different time, after verbs, in different time, appear secondary, secondary ossification center into the epiphysis. After verbs, in different time, the secondary ossification center appear into the epiphysis and change cartilaginous to bone. Cartilaginous to bone. Okay? So all secondary ossification center appear after birth and into the epiphysis. This part, remainder ossified, remainder cartilaginous. This part is remainder cartilaginous. For this reason, it's called growth plate. Growth plate is cartilaginous structure. Growth plate is cartilaginous structure between diaphysis and epiphysis. Between diaphysis and epiphysis. What's function of the growth plate? What? Elongation of the bone. The function of the growth plate is elongation of the bone. Okay? The growth plate must be ossified in adult age. Okay? Must be ossified in adult. Which of them ossify earlier? Which of them ossify earlier? For example, humans has proximal and distal growth plate. Which of them ossify earlier? Proximal or distal? Proximal. We know that all long bone has a nutrient artery. This artery shift to one side. For example, this one. Shift one side. This one. Okay? Shift this one. Blood circulation into the upper limb bones. Blood circulation in upper limb bones is toward elbow. Blood circulation in humerus is toward elbow. Blood circulation into the ulna and radius is toward elbow. Okay? For this reason, epiphyseal plate near to elbow is ossified earlier. But distal epiphyseal plate of the forearm, and proximal epiphyseal plate of the arm is ossified. For memorize. You can this figure. Okay? This figure. In this side, we can see bones of the upper limb, humerus, ulna or radius. Okay? This one is epiphyseal plate. This epiphyseal plate near to elbow is ossified earlier. Okay? This one is ossified, yes. In lower limb is opposite. Growth plate near to knee.
Patella.
Okay? Is ossified delay. Is ossified delay. For this is you can see here distal of the femur, proximal of the tibia or fibula is ossified delay. For this is when you elongate your posture, okay? Then you elongate posture, girl sense a pain near the knee because these those blades are active. Okay? One of my question in exam is here. Which vertebrae is ossified earlier or later? You must memorize this law. In upper limb, blood flow is toward the elbow. This is and this area is elbow. In lower limb is opposite. I sit under a shower. Okay? Water flow in upper limb is toward elbow. In lower is away from the knee. This area is ossified earlier. This area is ossified later. This figure shows the beneficial effect of plan in the anatomy. Okay? Sagittal, coronal, horizontal plan. Sagittal section of the brain, this figure. Coronal plan of the brain, this figure. Horizontal plan of the or horizontal section of the brain. When I want to see ventricle of the brain, this figure is very good. This one is ventricle. When we try to see corpus callosum, this one is connected right and left. Okay? This one is injury into the MS disease, multiple sclerosis disease. For this is where I want radiologist produce this figure for evaluation of this situation. Okay? Movement. I act a move and you name of it. This one. Flexion of shoulder. Shoulder flexion. This one.
Wrist.
Finger flexion. Okay? Extension of shoulder. Elbow. Finger. Okay? Shoulder abduction. Wrist abduction. Finger abduction. All joints, the criteria for abduction and adduction is midline. But in the hand, criteria is middle finger. Middle finger, this one is abduction, this one is adduction. Okay? Abduction, adduction. This one, adduction. This one, adduction. This one,
Wrist
adduction. Okay? Thumb is different to fingers. Okay? Abduction and adduction in fingers take place on coronal plan. but if the thumb is into the sagittal gland, abduction, 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 abduction. Dysfunction, extension, flexion, extension, flexion. Okay? Thumb is different to fingers. All movement of the thumb is opposite to finger. Abduction, abduction, of finger is on coronary gland. But for thumb is extension, flexion, extension, flexion. Flexion, extension of finger is sagittal gland. For thumb is abduction, abduction. In sagittal gland, abduction, abduction. Okay? This one. Opposition. Opposition. Thumb and little finger has opposition. Opposition. Okay? This one.
Rotation.
Rotation. Rotation. This one is rotation, but this one is complicated to supination and pronation. And this is on the elbow is flexed. This one is lateral rotation. This one is medial rotation. Lateral rotation of shoulder. Lateral rotation of shoulder. Medial rotation of shoulder. Elbow has just flexion and extension. This one, supination, pronation, supination, pronation of forearm, of forearm, supination and pronation of forearm. This one, shoulder, protraction. This one, retraction. Protraction, retraction. Protraction, retraction. Okay? Okay. Name of muscles. Name of muscle. The name of muscle take me many information. For example, this muscle is biceps brachii. Biceps brachii. The origin of this name is shape of muscle. This muscle has two heads. For this is called biceps. Okay? Biceps. This one, this muscle. This muscle. Okay? This muscle origin from brachial insert to radius. It's called brachial radius. Origin of name arises from attachment of muscle. This muscle attached brachial and radius. For this it is called brachial radius. This muscle is supinator. The name of this muscle arises from action of muscle. Action, function of muscle. This muscle is supinator. This is called supinator. Some muscles are nominated on attachment, shape, function. And final, this muscle. This one is scapula. This one is spine. This area is infraspinal. For this muscle is called infraspinal location. Location of muscle is origin of nomination. Okay? This is important because you know I ask you, for example, 1 this muscle, I can't ask you about origin and insertion because name show me origin and insertion. I must memorize function and innervation. Okay? About this muscle, I can ask you function of this muscle. The name of this muscle show me function. For this reason, I ask you origin, insertion, and innervation. Okay? What's meaning origin? What's meaning insertion, innervation, function? Origin is origin usually is above. Usually is above origin. Insertion usually is below. For example, brachioradialis, biceps, brachio. Okay? Origin is above, insert below. Origin is far away joint. Insertion is near the joint. Okay? Origin is far away joint. Insertion is near the joint. For example, this muscle, brachioradialis, origin from scapula, far away the elbow. Insert to radius, near the elbow. Origin and insertion. Innervation. All the muscles of the upper and lower limb are innervated by spinal nerves. Ventral or dorsal primary. Ventral primary. All muscles of the limbs are innervated by ventral primary of the spinal nerves. Superficial fascia. The connective tissue under the skin. In histology, you study as a hypoderm. In anatomy, it's called superficial fascia. Superficial fascia is under the skin. Superficial fascia is under the skin. Is mainly fatty tissue and contain vessel and nerve for supply of the skin. For example, the skin moves on superficial fascia. All part of the body contains superficial fascia because all part of the body contains skin. Under the skin is hypoderm or superficial fascia. The superficial fascia contains vessel and nerve for supply of skin. What is important? Deep fascia. The superficial fascia is mainly fatty tissue. Deep fascia is mainly fibrous tissue. Deep fascia is formed mainly by fibrous tissue. What's function of the deep fascia? The deep fascia separate compartment of the body. The deep fascia separate compartment of the body. For example, this one is femur bone. The thigh composed of three compartments: anterior, medial, posterior. Which structure separate them? Deep fascia. Deep fascia separate three compartments. What's beneficial of this structure? When each compartment is injured, this injury don't spread on other compartments. Okay? This one is injury. this injury is limited here. Don't split this one and this one. For this deep fascia is very, very important. Unfortunately, the face has not deep fascia. The face has not deep fascia. For this reason, renal injury show in the face by suspend of the eyelid. Okay? When your eyelid is suspended, show me renal disease because the face has not fascia. Face has not separated from other part of the body. Okay? Joints. Joint. Connection between two bones. Two or more. Connection between two or more bones. For example, this joint. What is this joint? Shoulder joint. It's between scapula and humerus. Two. Connection into the elbow joint is between three bones. Humerus, radius, spine. Okay? Connection between bones is called joint. Okay? There are two types joint. There are two types joints. There are two types joints. One, unmovable joints or fixed joints. Okay? Two, move other joint or mobile. Fixed joints. Bone. Okay? Two bones coming together when connector agent is fiber. This fiber, this one. This fiber. This joint is called fibrous joint. Fibrous joint. When connector agent is cartilage. This joint is cartilaginous joint. Other name is called seam. Seam is linked together. Seam fibrosis. Seam chondrosis. Okay? When the connector agent is bone, this joint is called osseous joint or seam osseous. Seam osseous. Seam chondrosis. Seam fibrosis. Okay? Seam fibrosis. In this figure, you can see seam fibrosis. The most important seam fibrosis joint. When we have the joint between cranial bone is fibrosis. For elongation, for enlargement of the brain, this is the skull is articulated by fibers. After the enlargement is completed, the fibrous is changed to bone. The skull joint of bone, all of us, okay, is same osseous at present. When reverse, this one is same fibrous. Okay. This one, joint between tooth and alveolar bone, lower and upper. Okay. This one is fibrous, thin fibrous. In this area is called composite. It is not important for you. It's important for the dentist. Okay. But you must learn this joint is thin fibrous. In limb, there is one joint. There is just one joint is fibrous. This one is called, this bone is tibia. This bone is fibula. This joint is tibial fibula. But you can see superior and inferior. This one is inferior. Tibial joint is fibrous. Okay. Synchondrosis. This joint between rib and chondrus, between rib and rib cartilage is called synchondrosis or chondrosis. There is no difference between rib and cartilage. Okay? Costochondral, rib and cartilage is cartilaginous joint. But there is another cartilaginous joint. This joint is bone, okay? This cartilage between the bone is hyaline cartilage. Hyaline cartilage. Okay. When this cartilage is changed to fibrocartilage. This joint is called chondrosis type 2. Chondrosis type 2. Synchondrosis type 2. This one is called chondrosis type 1 because connector agent is hyaline cartilage. Okay? But this one, intervertebral disc, and this one, joint between right and left hip bone. This one is symphysis pubis here. Symphysis pubis. This one is intervertebral disc. This one is fibrocartilage. So this is called chondrosis type 2. Chondrosis type 2 is midline of the body. In midline of the body, all joint is fibrocartilage. Is chondrosis type 2. Symphysis pubis between xiphoid and sternum. Between sternum and manubrium, okay, intervertebral disc, all of them is in midline. All of them is formed by fibrocartilage. For this reason, all of them is called chondrosis type 2. Chondrosis type 2. And mobile joint. Other name is called synovial joint. Synovial joint. All synovial joint has 6 factors. All synovial joints are movable and has 6 factors. 1. This one and this one. Okay? Bone surface continuing to formation of the joint is covered by hyaline cartilage. Is covered by hyaline cartilage. Cell articular surface of bone, articular surface of bone is covered by hyaline cartilage. Two bones connect together by articular capsule. Articular capsule. Okay? Inside of the articular capsule, is leaning by synovial membrane. Synovial membrane secrete synovial fluid. The synovial fluid lubricates articular surface. And finally, all of them produce movement. All synovial joint has articular capsule. Articular surface is covered by hyaline cartilage. Inside of the articular capsule, leaning by synovial membrane. Synovial membrane secretes synovial fluid for lubrication of the articular cartilage. Okay? The shape of the surface produces subdivision of the synovial joint. The shape of the articular surface produces subdivision of the synovial joint. For example, when two surfaces is plane, okay? This joint is called plane joint. Synovial joint, sometimes plane joint. Plane joint you can see there. What is this here? Clavicle and acromion. This joint is called acromioclavicular. Type of this joint is plane. Carpal bones articulate together. Type of this articulation is plane. Okay? Plane joint in upper limb, there are two areas. Acromioclavicular joint and name of this joint? Intercarpal joint. Okay? When the articular surface is ball and socket, okay? Socket and ball. This joint is called ball and socket. Just joint with the upper limb is ball and socket is shoulder joint. What is the difference between shoulder joint and acromioclavicular joint? Shoulder joint is ball and socket, acromioclavicular is plane. What What's the matter? Why we need to learn it? The shoulder joint is ball and socket. For this reason, the shoulder joint has three side movement: flexion, extension, abduction, adduction, medial and lateral rotation. But phalange joint has not this movement. Phalange joint is sliding, spinning. Okay? There is movement, but this movement we cannot sense. We cannot inform it. Okay? Acromioclavicular joint has a movement, but this movement is not informed me. Intercarpal joint has movement, but we cannot inform me. This movement is between radius and carpal. No intercarpal. Intercarpal has a sliding, spinning. Okay. Other type are saddle because shape of the joint is saddle shape. In upper limb has two saddle joints. One is joint. This joint. What is this? Sternoclavicular joint is saddle. And this one between carp and metacarp, between carp and first metacarp. For this then, we can this movement: abduction, adduction, flexion, extension, and no, this one is circumflexion. Compound of other movement is circumflexion. First, carpo metacarpal joint is saddle type. Saddle type. First, carpo metacarpal. Helene, we can see acromio, saddle is into the vestibular and first carpal. Helene, acromio clavicular, intercarpal and other carpo metacarpal. Other carpo metacarpal. First carpo metacarpal is saddle, other is helene. First carpo metacarpal is saddle, other is helene. Second, third, fourth, okay? Or helene type. Carpo metacarpal is helene type. Okay. Condyloid type. Condyloid. This one, wrist joint or radiocarpal joint. Wrist joint or radiocarpal joint is condyloid because we can see flexion, extension, abduction, adduction. This one is condyloid. This joint, condyloid. What is this joint? Between metacarpophalangeal. Metacarpophalangeal joint for all fingers are condyloid. Abduction, adduction, flexion, extension. Okay? And finally, hinge joint. Hinge joint. Where is hinge joint? Upper leg. Elbow. You can see flexion, extension. Just flexion, extension. And interphalangeal joint. We can see flexion, extension. No other movement. Hinge joint. This joint is called sternoclavicular type. Saddle. This joint. Acromioclavicular type. And then this joint. shoulder joint or glenohumeral joint. Okay? Balance up. Elbow, thigh, hinge. Name of the joint. Radiocarpal or wrist. Thigh. Condyle. Carpometacarpal. All the carpometacarpal are plane, except first is sagittal. Metacarpophalangeal. Interphalangeal. Hinge. Okay? Intercarpal. Plane. Intercarpal plane. But this joint is made. This joint. What is this joint? Radio-ulnar, superior and inferior. We can see this movement, supination, pronation. This movement takes place in radio-ulnar, superior and inferior. The name of this joint is superior and inferior radio-ulnar. The type of this joint is pivot. Pivot. Okay? Which of these joints are talent for injury? Which of these joints is injurable? Shoulder. Why? Because it has many function. Many function is good, but is injurable. In opposite, the joint is a few function. For example, plane is not injurable. Okay? Laxity, many movement is injurable. Okay. What is this? Synovial membrane. This synovial membrane is important in joint because this one is tendon of muscle. This one is tendon of muscle. Okay? This one tendon of muscle. Tendon of muscle is injurable because crushing to bone. Okay? For pelvication of it, the sac of the synovial membrane, the sac of the synovial membrane produce and is located between tendon and bone. This sac is like a pillow. Okay, and protect the tendon. This structure is called bursa. For example, this muscle is quadriceps femoris. Okay, the tendon of it attached to tibia, but this tendon is injurable. For pelvication of it, there is some bursa. This bursa is above patella. It's called suprapatella. The bursa below patella is called infrapatella. The bursa between patella and joint is called between patella and skin is called peripatella. Okay? Infrapatella, suprapatella, peripatella. This bursa prevention of injury to quadriceps tendon. Okay? Oh, my knee is painful. This pain may be produced by injury to cartilage, injury to joint. Okay? and injury to bursa. Which difference between injury to bursa to other? I can't touch cartilage. I can't touch articular capsule, but I can touch bursa. When pressure on bursa and when it is painful, this one show me the bursa is injured. Bursa is inflamed. Okay? It's called bursitis. Bursitis is meaning inflammation of bursa. When touch produce pain, show me bursa is injured. Okay?